The majority of zoonotic animal diseases that cause respiratory disease in humans are transmitted when aerosolized pathogens travel through the air and are inhaled by a person. As stated previously, this form of disease transmission is called airborne transmission. Pathogens can become aerosolized in a variety of ways and from different tissues, including but not limited to a sick animal coughing, sneezing, or vocalizing, medical procedures such as lancing an abscess, dentistry, or aiding in the birthing process, or husbandry procedures such as sweeping, vacuuming, or high-pressure spraying, which can aerosolize pathogens and excreta. Clinical signs in animals vary depending on the pathogen. Some diseases, such as tuberculosis in cattle or avian influenza in poultry, cause animals to cough or sneeze, while other diseases, such as brucellosis or Q fever, cause abortions. It is also possible that an infected animal shows no signs of disease, which we call asymptomatic, or their clinical signs are nonspecific and do not pinpoint an exact disease process. The picture on the top right shows an emaciated cow that is ill with tuberculosis. The bottom picture is of a chicken displaying clinical signs of avian influenza. The inside of the eyelid, called the conjunctiva, is congested and has areas of hemorrhage, which gives the conjunctiva a red appearance instead of light pink. Even though animals may not show respiratory signs from the pathogens mentioned in this presentation, humans usually develop respiratory symptoms when these zoonotic pathogens are aerosolized and inhaled. Aerosolized pathogens gain entry into the nose, sinuses, or even further down into the lungs. Humans usually experience symptoms similar to the common cold, such as coughing, with or without blood, and a runny nose, or more flu-like signs, such as fever and fatigue. One of the most important measures that can be taken to prevent disease transmission is to maintain good hand hygiene. This means washing hands with soap and water for at least 20 seconds after having contact with animals. In addition to washing your hands, depending on the disease and situation, personal protective equipment should be worn. This can include gloves, facial protection such as goggles, protective outerwear, and, especially if there is concern about pathogens that can affect people via aerosol, respirators. An N95 respirator is a readily available type of respirator that is designed to filter at least 95% of airborne particles. Talk to your doctor first about whether it's safe for you to wear a respirator. To decrease spread of disease from farm to farm, it is important to practice good biosecurity. After working with animals in one location, equipment, including boots and surfaces, must be cleaned and disinfected prior to leaving. This will help to decrease disease contamination with fomites. It is also important to purchase healthy animals and to isolate new animals or animals that appear to be sick. And finally, before cleaning or disturbing dried excrement or dust, water should be used to dampen the area. Dried excrement and dust are easily aerosolized, so wetting down the area will help to decrease the number of airborne pathogens.